25.7 million Americans currently do not have health care insurance. And that's according to the American Community Survey data from the Census Bureau. Along with the millions of Americans that are uninsured, I too face that problem. I don't receive employer-based insurance. I don't qualify for Medicaid, but I also can't afford all the co-insurance, co-payments, and deductible that's under the Affordable Care Act. My name is Maciel, and today I want to talk to you about Medicare for All. I will be discussing all of the benefits that we will be reaping in one of the world's richest nations. Changes from a multi-payer healthcare system to a single-payer healthcare system. According to the World Health Organization, all people should have access to needed health services, including prevention, promotion, rehabilitation, and treatment of sufficient quality to be effective, while also ensuring that the use of the services do not expose the user to financial hardship. Over time, the healthcare system of the United States has collapsed. One of the reasons why our healthcare system is broken is due to the increase in costs of the prescription drugs, in specific, specialty drugs. The pharmaceutical companies are the only one that's benefiting from the patient's illnesses. Cancer drugs are a great example of the increase in healthcare that's intolerable. Today's cancer drugs are effective, but to what cost? Treatment for cancer is at an all-time high, $400,000 a year. According to the CNBC's, a new study from academic researchers found that 66.5% of bankruptcies is linked to medical issues. According to the NCHS, which stands for National Centers for Health Statistics, in order for people to save money, 8% are not taking their medication as prescribed. Instead of taking the medication twice a day, they're taking it once a day. So it would last a little bit longer. 15% are requesting generic brands instead of brand names, so it can be a little bit cheaper. 2% are purchasing the medication from another country, and 4% are using alternative therapy. Another reason why our system is broken is due to the health insurances. They are charging for their services, but they're not covering for medication, and they're not covering for tests. Therefore, they are delaying treatment for the patient. I've worked in the medical field since 2007, and I've seen so many cases where when insurances have unjustifiably denied care because they didn't think it was medically necessary, even though the doctor did. I've seen cases when benign tumors have turned into malignant tumors because the insurance company didn't approve the excision. I had an interview with Dr. Mark Hart, which is an orthopedic surgeon here in Daytona, and he has witnessed the downfall of the healthcare here in the United States. He states that all these denials are affecting the doctor-patient relationship. He also states the doctor should be able to make decisions regarding the treatment of the patients without the intervention of the insurance companies, like it was 20 years ago. A single-payer system has demonstrated to be successful in other countries such as Canada, Sweden, Thailand, Denmark, and Norway. In our case, the single-payer system is Medicare for All. Medicare for All simply means having all the Americans under the government's insurance, which is Medicare. Right now, it is reserved for 65 and over. This will cover all medically necessary services, primary and preventive care, mental care, deductibles or co-pays for medical services. With a show of hands, who here has medical health insurance? Okay. Imagine receiving and having access to the proper preventive care you deserve as a basic human right without having to pay a monthly co-payment for this. Imagine getting equal treatment regardless of your background or your financial status. Imagine not having to choose whether going food shopping for your family or getting that MRI done that your doctor ordered. Imagine having to stay in that job just because they offer health insurance. Wouldn't that be life-changing? Now that you've imagined yourself with Medicare for all, I'm sure you want to know how you can help accomplish this. You can be part of this amazing change that's going to benefit all of us, the Americans. We're going to have all of our basic needs covered. There are several ways you can help. You can sign the petition on publiccitizen.com to ask the 2020 debates on how they will guarantee health care to everyone in the U.S. Or you can email your representative and urge them to co-sponsor the Medicare for All Act of 2019 that's also on the publiccitizen.com. Finally, the most definitive action you can take is when choosing the next president in 2020, please take an in-depth look at what the candidates have to offer and make sure he or she puts our health care first. In the words of Senator Bernie Sanders, health care must be recognized as a human right, not as a privilege. Thank you.